Oh, there we go. Excellent. All right, so we're moving into the innovation focus. Speakers from this morning, if I can ask you to leave the stage, I do believe you can still stay in the session and listen to the first session, which is going to be presented by Devon, I hope, who will be coming to the stage in a moment. Bear with us, please. Let's see if we can get Devon to the stage to talk about basically the project that Paul brought to the Social Care Digital Innovation Accelerator. That, as I said, Marion mentioned how many people actually applied to the SCIDIA. Actually, 50 local authorities applied and sent in challenges where they felt that digital could solve or support adult social care services. So there were 50 applications from local authorities and an open call to technical providers to try and match the most appropriate technical provider with the project. We had 200 applications from technical providers. So Devon from Policy and Practice, who I can't see on the stage yet, was one of those developers who applied to the SCIDIA and was best placed to deliver MAST, which, as I say, is the multi-agency safeguarding tracker. I'm just going to ask my colleagues if Devon is here. Colleagues, is Devon here? Otherwise, we might want to skip on. Devon, are you here?
He's here. Livestorm's just going a little bit slow. He's just getting ready.
Brilliant.
Okay.
Okay, so like in the real world, this is like Devon's train's been slightly delayed. He's just taken off his coat. He's walking up to the stage. Okay, so yeah, so Devon and Policy and Practice have led on multi-agency safeguarding tracker. I'm going to just do this introduction screen so we can keep to time. This project, as you've heard from Paul, has involved Walsall Council, that's the children and adult services. It's involved West Midlands Police, West Midlands Fire and Rescue, and West Midlands Healthcare, their NHS trust there. So this is all about sharing data to improve safeguarding and, as Paul was saying, really address that kind of prevention angle. Bear with us, please. You can't have a digital event without a little bit of a digital hiccup. So is Devon nearly here? Maybe it's time just to have a quick coffee. Maybe we should just say 2 minutes.
Yeah, quick coffee.
All right, let's say that. Should we say that Devon will hopefully be here in 2 or 3 minutes time? So check your emails, maybe go to the toilet, grab a coffee, and we'll start again in about 3 or 4 minutes. Does that make sense? Oh, Devon's typing. Okay, we're going to get Devon into the system to start the quick fire sessions.
Hello, can you hear me?
Oh, fabulous. We can see you and hear you, Devon.
That was so much more stressful than missing a train. Hi, everyone. How are you all? It was all working fine, and then the screen was just spooling, and I didn't know what to do. So I've just refreshed. Hello, everyone. And yeah, that was a brilliant session, I thought, Jane. Great to hear from everyone there, and thank you all for joining me today. It's been an absolute delight to work on MAST. And I know you know a little bit about it from the session just before, which I was listening in on. It's been a co-funded project by CC2I and local government, NHS Digital, Walsall, West Midlands Council, all of these partners on screen that you can see. I thought I would just kick off, if we move on one more, and say a bit about why, I think partly why Policy and Practice were approached, but then also why Policy and Practice accepted it. So I'll start with, this is a bit of the background to it. It is all about, fundamentally, it's got an incredible purpose to it. And Paul Withers has, as he said, I think at the start, it's been something that he's had in the back of his mind for some time. And I think, firstly, Policy and Practice were asked to do it because we've got a lot of experience working with administrative data, mainly benefits administration data. So we process universal credit, housing benefit, council tax support data for about 40 councils across the UK. And because it's DWP, benefits data is incredibly sensitive. So in the same way that the safeguarding work is all about sensitive data, you need that capability to be able to just handle that technical side of it well and robustly. So I think that's one reason why we were asked. And I'll make this just a quick point, but because it relates to social care, one of the things we do with benefits data is identify, for example, people with care needs who should be claiming pension credit but aren't. And it's a really good way to kind of reduce or increase people's incomes or increase their financial resilience. So they dip into needing care later and managing demand that way. So I think that's how CC2I and Walsall and the West Midlands partners came across us. The reason we took it on, if we move on one slide more, is we've been doing this we've been asked to do or get involved in other linking projects for some time, and they've all fallen apart. That's the best way to put it. Like getting data linked across different partners is a very difficult thing to do. And we've had our fingers burned. So I thought I'd talk a bit about why we spent a lot of time thinking about, shall we take this on? Is this real? Can we make it happen? I think there are 3 reasons why I felt like MAST was different from other approaches or other efforts we've made to try and link data across departments. I'm a big believer in the power of administrative data. I think it's all there, but I think there are just a whole range of barriers to really making it happen. I think the first one is purpose. So often local authorities or any other organization just wants to put data together and figure out what that's going to give you. What was different about MAST was there was one very clear purpose, which is to help safeguarding professionals make better decisions. And I'll talk about the problems and the challenges they face, but having a single clear purpose means that you can get partners aligned behind. No one's saying, well, why are we doing this? It's very clear. So you've got that ability to kind of bring partners on board with you. The second big piece is governance. So the number of these projects that fall down because governance step in too late, they're not involved at the outset, or there's something that you missed. MAST has got clear legislation allowing for the information to be shared from safeguarding legislation. As we've worked with other partners, there are other bits of legislation that they have access to, particularly police and fire, which allow them to do potentially even more with this in future. But that governance piece was just rock solid from the outset. And with Paul Withers, a data protection officer across the West Midlands, across Walsall Council, he had the connections across the West Midlands to really reassure and bring them on board right from the outset. And that's something that, again, we're taking forward in the other discussions with other organizations, is dealing with that governance bit up front, making sure the governance teams are involved right from the outset. And then finally, impact. So as I said, administrative data, I think, is the future of social policy. The opportunity to link, as we have done, it's almost hard to believe that we've done it, to link data across adults, children's, fire, police, and NHS. It's huge. I'm really proud of the work that we've done. There's nothing else that I can say, and I think a lot of that, technically, it's been actually relatively straightforward, but getting it through governance, getting access to the data, that's what's been made possible by this project. And I think it's much more repeatable. Obviously, the lessons we've learned means, I think as Paul said, we can move forward with this with other partnerships much faster and much more smoothly with a completed project at the end. Obviously, we were developing MAST alongside this. So if we move on, next slide is just about some of the problems and challenges people face. I think the headline here is really just there's lots of friction. So if you're a safeguarding professional and you want to find out whether or not there's been contact with other services, there's lots of friction in finding that out. Who do I contact? How do I see it? What about data? What about information governance? MAST is trying to solve all of those problems. And that has two main bits of impact. The first one, we don't talk about it enough, but time savings, like making it easier for safeguarding professionals to just access the information they need, having that feel like a good system. The second one is impact. So having impact, my daughter's just joined me. She can join me very quickly and then go, okay, go find Mummy. Take care. She had an impact there. The second one is impact. So saving safeguarding professionals time, and then having an impact fundamentally by just protecting people who need protecting, or making better safeguarding decisions. Do I keep this case open? Do I keep this case closed? Making sure you've got all the information at hand and you can access it easily when you make that decision will lead to better outcomes. And that's the thing that I think is really, really important and really moving. If we move on. Thanks. So that's what MAST is. It's a data-driven solution. It allows partners who have a mandatory responsibility for safeguarding, so it's for people with safeguarding responsibilities to be able to access it, for them to be able to securely share headline data. So just to see whether or not there's been contact. There's no case data stored within MAST, but you can see who to contact if you want to find out more. It's underpinned by a clear, detailed, documented information governance structure, and actually even just helping organizations through that, I think can add a huge amount of value. If we move on, I think we've got a visual of MAST. My colleague James Rawlins will be demoing this at the 1 p.m. lunchtime session, but I wanted to include this slide just to kind of show you how it's really quick, simple, straightforward to use. So you can see it more in the lunchtime session. I want to sort of focus on the impacts and the next steps. So if we move forward one more. Next few slides are just on process. I've got a data sharing agreement, holding workshops with organizations, detailing the schema, getting the data out. It was all it worked really well. We got the sample data, we were able to show the impacts, and you'll see that in the next slide. And then really the gap was between 7 and 8, so going from sample data to getting daily updates received. This is the kind of data that we get from partners. So again, just detailed information across adult social care. I'll let James kind of pick this up because it's one level of detail too far, I think, for this introductory bit. But again, the thing to emphasize here is there's no case data. And what we're doing is linking records across partners to see if there's been contact with other services. And then it's for safeguarding professionals to follow that up. They know when to use who to contact, so their professional judgment can be better informed. We move on. There's lots more I could say about the records and the data matching and the processes around it, but probably not in 15 minutes. Here's an initial sample. So initially we collected 3 months of data, and just to show the value of it, saw how many linkages they were. You can see that here, and I think the best thing to highlight is that you can see interactions that people weren't aware of that feel like they're very important, like children's services seeing that there have been 3 fire call outs to the same address that they didn't know about before. So we got that from the initial data match. If we move forward. Apparently slides aren't moving on for everyone. I'll let the technical team look into that. But if you just listen to the words, I'll try and illustrate, and the slides will go out afterwards, Rebecca. Just the next 3 slides are just highlighting 3 cases we looked into, both from a data perspective and then with the frontline professionals. So again, validating that the data in it is accurate and working well. So there was a case of coordinated prevention. A mother and her adult daughter were known to social services. There've been lots of issues in the past. It was a very high frequency call out, so very expensive family to look after, with ambulance call outs, police, health. So social care knew about it. There've been lots of safeguarding concerns raised previously, and there hadn't really been any take up of it. What MAST was able to show that was, again, it's a high incidence case. It made sense to kind of wrap around and take a coordinated approach across partners. And by doing that, it actually kind of in flight with the MAST system, they're able to identify actions, powers, how to escalate steps. So they could take a much more coordinated approach. And I think it went to the self-neglect panel to move forward. So that's kind of one example of coordinated prevention, being able to see where there's high incidence and put the extra effort and resource around those that are high incidence cases, because that's what will drive savings across core services. The next one was informing case closures. So a sibling, there was a case closure decision pending. What the user of MAST could see was that there were interactions with other services that they weren't previously aware of. They were able to then contact NHS, fire, police to find out what happened and then make a better informed decision. It's not about the system making decisions for you or making assumptions about what this was about. It's about professionals being better informed so they can make better decisions as a result. Thanks. And then the third one is rapid lateral checks. So this is about speed, really. So just being able to see very quickly and easily, again, an older person, mental health issues, conflicts with neighbours. There was just the ability to carry out these lateral checks right from the outset. There wasn't that much known about the person to the safeguarding team, but they're able to see actually what do these other services know about this household. It meant that social workers could just carry out those lateral checks much more easily. And again, that drives time efficiency savings in reaching the right decision. So those are just 3 examples that I hope really hit home. They're all very kind of solid and real. And then for the partners involved, I think really what I want to focus on here is just the quotes on the left-hand side. So I'm really delighted with the feedback. We've been interested in ways of doing this better for 10 years. It's great that it's finally happening. And it's been great from my side to have been a part of that. We can see just how useful this is going to be. Again, from another frontline professional as well, who we did have frontline professionals at the start thinking, okay, is this another system that I'm going to have to enter more data into? I don't really, and actually you don't have to do any of that. It's all automated in the background. What you've got is a front end screen that you put in information. You can see whether or not there's been contact with other services, and you can see how to contact those other services. Now, the scope of MAST may grow over time, but fundamentally that's the core purpose it was built for, and the core purpose it delivers on. There's a good list here of people you might want to involve if you want to talk about it. So the different teams. Interestingly, over the course of MAST, we've had sort of other services, so mental health services, ambulance services, potentially wanting to put their data into MAST, which would again give that fuller picture. And that's come through again, just being part of the CC2I initial pilot project. And we've got lots of interest from other parts of the country who want to take MAST on, which I think is really exciting, obviously. And then the people within each team. So you want a team lead, you want a project manager, but you want your data protection officer as well involved, your technical team, so that they know it's happening. And as Paul said, having that senior sponsorship in it from the outset. So it can't all be done at sort of, you want there to be this overarching, we're all partners together, we want to share this data, we understand why it's happening. Being able to convey that easily has been really important and powerful. So I don't have that much more to say, just because I was conscious I only had 15 minutes, and with the delays at the start, I'm more than happy to hand back. But if you want to join the lunchtime session, my colleague James Rawlins will be walking you through MAST, telling you more about the technical steps we took to get the data, link it all up, and roll out the system as well.
Brilliant, Devon, you're a star for jumping in and being compact. We've got one question. Can you take one question?
Yeah, sure.
Does this work across local authorities? If someone moves to another area, we've had a recent subject access request in which one of the issues was that a person had moved up and down the country and was known to other services out the area. I know this is something that we addressed, have spoken about. So
yes, absolutely. So across the West Midlands, currently we're just working across the West Midlands. But for example, if there was, so we've got Walsall Council, if we had Coventry Council as well involved, you'd be able to see movement from, you'd be able to see across both. So it's really about, as long as you've got the partners involved, you can see that contact. The goal ultimately, I know for Paul, is to make it a national system. I think for the time being, we're just talking to regional areas and making sure it's powerful within region, which is usually a large enough geography. But ultimately, there's nothing stopping those regions connecting that information up together. It's just they all need to be part of a data sharing agreement. So it makes much more sense to do that regionally at the outset. And with some momentum, we can do a bit more thereafter.
Brilliant. I know we had a session with London last week, didn't we? And that, that came up again, people moving around the city and, being able to share that data from all the different authorities. But then, we're speaking to Lincolnshire around, the county lines kind of problem. And I think it also, builds on all of those people who move around and just ensuring that they're kept and supported within the safeguarding system. Yeah.
And what's interesting. Okay, no, I'll let you go.
No, go.
No, it's just going to be the fact that we're pulling, it doesn't matter what system you've got. So what we're doing is pulling in consistent information from whichever system you've got, whatever you're using across adults, children's, fire, police, NHS. We're just pulling out key information that you have to be capturing in those systems, pulling them in and linking that. So it doesn't really matter. There's no compatibility issues, particularly between Lincolnshire and London. There's no reason why you can't share that information, provided you've got that sense of collaboration across partners.
Yeah, and the information governance, which is there that everyone signs up to. So brilliant. Apologies, Jackie. I said subject access review when it should be safeguarding adult review. Same acronym, but I think we've answered your question. So hopefully that's all good. Brilliant, Devon. You're a star. Thank you ever so much. I think my colleague is. Take care. Thanks. My colleague's going to drop into the chat now the link, and you'll see it on your screen now. If you want to join Devon, well, actually, James, he's going to be taking you through MAST and really showing you how the system works, putting in data, using dummy data.